I am Dr. SUSHIL Kumar Rahi, consultant neurologist at Swahana Hospital, Mohali. Today we'll learn how to recognize certain emergency situations in epilepsy. Most seizures, as you all know, last for around say 2 to 3 minutes, but few of them may have severe life-threatening seizures. For example, a patient may be having a prolonged seizure, or may be having clusters of seizures, or he may be having regular seizures. Such emergencies may lead to brain injuries, so they have to be timely recognized and treated accordingly. There are some out of the hospital medications which can be procured by the patient himself that can be used in such cases by his caregiver. They usually include nasal sprays and they might help to terminate such life threatening seizures. Now, suppose whenever a patient comes, he or she should know he is likely or he is more susceptible to have such severe seizures. So we should ask a patient at all times if he ever had a status epilepticus, or he had one seizure after the another, or clusters of seizures on a single day or few days, or long periods of confusion after seizures, or if he had stopped medications on his own. These are the conditions which may lead to life threatening seizures. Also, few patients that may be having other things like brain lesions, some brain occupying lesion or SOL as we say, or tumor, or if the patient is living alone, because if somebody is living alone and he throws a continuous life threatening seizure, there will be no one to look around him, or if the patient is having seizures in sleep, or if the patient is on multiple anti-epileptic drugs, and if the seizures are poorly controlled. So these are the basic subset of things that should be conveyed to a patient or should be asked during history taking. And these may help to highlight few of the patients who may be susceptible to these life-threatening conditions. Now, secondly, we have to identify conditions for immediate medical attention. Now, suppose a patient is having seizure which is lasting for more than 5 minutes, as we say, he is having status epilepticus, or he is having impaired consciousness between seizures, and if we find that he is having difficulty in breathing at those times, or if a patient has injured himself during a seizure, like he has broken a bone or he has cut his tongue severely, leading to severe bleeding, or if it's a first seizure or there is a change from patient's usual seizure pattern. So these are the conditions that call for immediate medical attention. We don't have to wait. We have to advise some treatment. We have to offer some treatment. We have to give some treatment. Now, whenever such patients are patients of life-threatening seizures, prolonged seizures, they come to the hospital, they have to be investigated thoroughly. That may include blood tests, CT scan or MRI, even the CSF, and highly advanced tests like EEG has to be done or offered. Emergency treatment is usually IV medication because the patient may be unconscious, he may not be able to swallow tablets of the regular antiepileptics that he had been. So most of the times, such life-threatening seizures are controlled by using intravenous medications, and these has to be given under the care of a neurologist. Now, suppose a patient who is prone to such life-threatening conditions, we have to also help him understand what are the things that can be done to him when he shows such type of seizures at home. So his caregivers have to be taught, and so they have to be taught how to prevent injuries, like a patient may be cushioned accordingly. The patient may be turned to one side so that if he vomits, he doesn't aspirate his own contents. We have to loosen any tight neck wear so that there is no difficulty in breathing. And we also have to tell the caregiver not to put anything in the mouth during a period of unconsciousness or prolonged seizures, not even the regular medicines that a patient had been on prior to these life-threatening seizures. So this is in basic outline the things that have to be looked for in cases of refractory or life-threatening seizures, and they have to be dealt accordingly to save the life of the patient in need of our. Thank you.